The Oxygen Administration Station tests the EMT candidate's ability to assemble the equipment needed to administer supplemental oxygen to a patient, beginning with a non-rebreathing mask and then changing over to a nasal cannula.
This is the oxygen administration skill. First, I want to make sure I have my BSI on, my safety glasses and my gloves, and that the scene is safe. Next, I want to attach the regulator to the oxygen tank. I want to ensure first that I have a good seal, make sure I have an O-ring in place here. I'm going to align the 3 prongs on the regulator to the 3 holes on the valve on the tank. Place the valve in the correct slots, tighten down the T-handle until it's hand tight.
Assemble the regulator and oxygen bottle, making sure that you have the correct gasket or O-ring and that it is properly seated. Slide the regulator over the neck of the oxygen bottle, ensuring that the pin setup is on the proper side. Use the thumb wheel on the back of the regulator to tighten it down,
making sure that the O-ring is seated properly. Once attached, open the cylinder valve to check for any leaks and to determine the tank pressure.
I'm going to open the tank valve about 1/4 to a 1/2 turn. I'm going to listen for any leaks, and I'm also going to make sure that there's at least 2,000 psi on the regulator pressure gauge.
Turn the oxygen bottle on and ensure that there is enough pressure in the tank to deliver the oxygen that is required. Take the oxygen tubing on the non-rebreather mask and attach it to the regulator. Pre-fill the reservoir bag on the non-rebreather mask by placing a finger over the oxygen inlet hole and then opening the regulator.
No, I have 1,500 pounds of pressure.
Attach a non-breathing mask to the regulator. Adjust the flow rate to at least 12 liters per minute. Fill the reservoir bag before applying the mask to the patient. Adjust the mask to the patient's face.
A medical direction to apply oxygen to the patient, a non-rebreather mask. So I'm going to take a non-rebreather mask and hook it up to the low pressure side of the regulator. I'm going to turn this to between 12 and 15 liters per minute. And I want to ensure that the bag fills entirely prior to administering to the patient. That seems ready to go at this time. Place this over the nose and mouth of the patient, behind the back of the head. Make sure I have a tight seal by pinching the aluminum strip right here.
If the patient cannot tolerate the non-rebreathing mask, discontinue its use and switch to a nasal cannula. Adjust the liter flow to 6 liters or less per minute and place the nasal cannula on the patient.
I can't wear this.
All right, sir.
Okay, because your patient is not tolerating it well, medical control has authorized you to go to nasal
At this point,
cannula.
I've been told the patient is not tolerating the mask. I've been ordered to administer a nasal cannula instead. So I'm going to remove the non-rebreather mask. I'm going to turn off the oxygen. Hook up a nasal cannula. I can set this between 1 and 6 liters per minute. I've been ordered for 6 liters, so I'm going to turn this on to 6 liters per minute of oxygen flow. I make sure that the nasal tubes align properly with the nares of the patient. Very comfortably place it in, and then around both ears, behind both ears, and then tighten it as a bolo under their neck right here.
If the patient is unable to tolerate the non-rebreather mask, remove it. Choose a nasal cannula and attach it to the port on the regulator. Adjust the liter flow to 6 liters per minute or less. Apply the nasal cannula to the patient by inserting the prongs into the patient's nares, ensuring they are curved downward. Hook the cannula tubing over the patient's ears, and then adjust the slide to secure it under the chin.
How does that feel, Brian? Better?
The examiner will advise you when to discontinue the use of the supplemental oxygen. At this point, remove the nasal cannula from the patient. Shut off the regulator